Hello, welcome to Dong Nai Radio and Television Station. Here comes the news today. Total state budget revenue in February is estimated at over 95 trillion dong. The first 2 months accumulation is over 276 trillion dong, equaling 18.3% of the estimate, up 9.3% over the same period last year. Domestic revenue in February is estimated at over 75 trillion dong. Accumulated revenue of 2 months reached over 230 trillion dong, equaling 18.4% of the estimate, up 12.8% over the same period last year. Revenue from crude oil in February was estimated at 3.9 trillion VND. Import and export activities were estimated at over 22 trillion VND. State budget balance was about 32.2 trillion VND, down 15.7%. This is the main reasons for the lower growth of the state budget revenue in the first 2 months. On March the 11th, my vice chairman of the Provincial People's Committee, Nguyễn Hòa Hiệp, shared a meeting with members of the subcommittee organized to serve the 11th Dong Nai Provincial Party Delegation, tenure 2020-2025. According to the report, up to now, the jobs related to logistics, decoration, festivals, and propaganda for the Congress have been carried out on schedule and met the requirements. Work items, facilities for the Congress are being urgently completed and installed. The plan to arrange forces to ensure security and order before, during, and after the general meeting is elaborated in detail. Speaking at the meeting, Vice Chairman of the Provincial People's Committee, Nguyễn Hòa Hiệp, proposed the subcommittee members, on the basis of their assigned functions and tasks, actively build and organize the implementation according to the set plan. Focus on information and propaganda before, during, and after the Congress. Department of Culture, Sport and Tourism is responsible for printing logo, invitations, decoration for the meeting. The provincial leaders also note that the subcommittee members directed the implementation of urban embellishment, contributing to creating a joyful atmosphere so that the Congress was truly a large political activity, a festival of all people. The National Steering Committee for Epidemic Prevention and Control COVID-19 has sent a dispatch to the presidents of the People's Committees of the province and cities on strengthening the screening and segregation of isolated cases of COVID-19 at medical examination and treatment facilities. The National Steering Committee asks the presidents of the People's Committees of provinces and cities to seriously direct the implementation of some urgent contents. Specifically, urgently continue directing medical examination and treatment facilities, including public and private sectors in the area, to organize screening, channeling, isolation, and management of treatment of epidemic cases under the direction of the Ministry of Health. In particular, special attention should be paid to screening patients as soon as they come to medical examination and treatment facilities. There is a sign posted at the gate of the medical examination and treatment facility for subjects with clinical symptoms, for example, fever, cough, shortness of breath, with epidemiological factors related to COVID-19. Generally, public and private clinics immediately after detecting suspected cases should record the patient's contact information and immediately notify the local health department or disease control center to take measures to monitor, manage, and isolate patients. Strictly deal with units and individuals that fail to comply with the above provisions, suspend or temporarily suspend, withdraw operation licenses, practice certificates for medical examinations and treatment establishment and individuals who violate. The COVID-19 viral disease that has swept into at least 114 countries and killed more than 4,000 people is now officially a pandemic, the World Health Organization announced Wednesday. On Wednesday, the World Health Organization, WHO, decided to declare an acute respiratory infection, COVID-19, as a global pandemic. The move comes after 4,200 people worldwide have died. Tedros still said that people should not fear the designation and that it should not be taken to mean that the fight against the virus is over. Describing the situation as a pandemic does not change WHO assessment of the threat posed by the virus, Tedros said. It doesn't change what WHO is doing, and it doesn't change what the countries should do. Mr. Ghebreyesus also expressed his fear at the level of alerting about the spread and severity of COVID-19, as well as the alert level of the lack of timely action in the prevention of epidemics. India said on Wednesday that all existing visas will stand suspended until April the 15th. The ban comes to effect at 12 p.m. GMT on March the 13th from the port of departure. The statement said the ban does not apply to diplomatic, official, United Nations, international organizations, employment and project visas, and also visas issued to diplomats. The Swiss federal government also announced the closure of a part of the Italian border on the same day. Specifically, it would immediately close 9 sub-checkpoints at the border between the two countries. But the main border gates still operate. Canadian Prime Minister Justin Trudeau on the same day announced a support package worth more than 1 billion Canadian dollars, over $700 million to help provinces and territories' healthcare system cope with the disease. That's all for the news today. Thank you for joining us and goodbye.